All right, welcome back. Now, at least 12 million people have been conceived through some form of assisted reproductive technology. This is now globally. In the last 45 years, in vitro fertilization has become the main treatment for infertility around the world. Well, this is because 1 person in 6 suffers from infertility. Closer home in Kenya, infertility is on the rise. And according to data from the Kenya Fertility Society, at least 1 in every 5 couples suffers from infertility. Now, the data also estimates that at least 4.2 million Kenyans require medical assistance to conceive. The most common reproductive problems are low sperm count, 0 sperm count, and blocked tubes. Now, the Kenya Fertility Society attributes up to 30% of infertility cases to men, 30% to women, and 40% to unknown factors. Now, with World IVF Day around the corner tonight, tonight we will unpack in vitro fertilization or IVF, the pain, the cost, and of course, the joys and pains that come with it. Joining me in studio is Dr. Rajesh Chaudhary, who's an IVF specialist, and Julia Thitai, who is the Assistant Vice President and Business United head from Fertility Point. Thank you both for joining me. Let's begin first with demystifying what infertility is before we get into the solution. So let me start with you, Doctor.
Thanks, Julia, for having me here. A day ahead of World IVF Day. So infertility, we say when a couple is trying for pregnancy with regular intercourse without the use of any contraception for a period of 1 year at least, and then they are not getting pregnant. So ideally, 80% of the couples should get pregnant with such try, and they will be labeled as infertile if they try for 1 year and then they are not getting pregnant, if they are below 35 years. Now, if they are between 35 to 40 years and if they are not getting pregnant within a 6 month of period, then they should be labeled as infertile after 6th month. Now, if the woman age is 40 years and above, then the time given is just 3 months.
Okay.
But having said that, if they have already a problem before, like underlying condition, like any medical condition or surgical condition that can lead to infertility, or say the menstrual period is already irregular or a condition like endometriosis, then even that 1 year period should not be waited for.
So what are some of the assisted fertility options that exist, Julia?
We have very many options. So first of all, Fertility Point has been established from 2018, and we offer a wide range of fertility options. The biggest one being in vitro fertilization, IVF, which is commonly treated across the world. We also have other options such as IUI, and also other treatment options such as sperm aspiration. We also do freezing of eggs because we'll have patients who are not able to conceive at a specific time, patients who go through cancer. Those are some of the treatment options that we give them across Fertility Point.
So the biggest question is, how much is it, especially for IVF?
Yes. So IVF is currently offered at a wide range, but currently at Fertility Point we have a market rate of 450,000, but we have partnered with various we've partnered with various companies that offer health financing. So if you come to us and you're not able to pay at that time, then they can be able to give you different options. And recently there was the Assisted Reproductive Technology Bill, which was tabled in Parliament, and that will actually help more Kenyans access universal health care because insurances will also be able to cover infertility for patients across Kenya.
You know, Dr. Rajesh, and as much as I'm hearing the cost, a lot of people are thinking, do I even have that money? Because that's per cycle, correct?
Yes.
So I read a very interesting statistic, this of course being the US because they're able to monitor, but they said 770,000 IVF babies were born in 2018, but this required 3 million cycles, right? So Dr. Rajesh, not every cycle is going to work. So you can think for every couple who spent, that 450,000, it doesn't work, you go back in, you're spending another 450,000. By the time they get the baby, how many cycles, do couples have to go through, or an individual?
So the success will depend on the age of the patient.
Okay.
And there are other factors as well. So younger the age, the lesser number of cycles is required. So on an average, it will require 2 to 3 cycles to get pregnant on an average. Okay. So 50% of the couple, they get pregnant in the first cycle of treatment. The remaining will get pregnant in second or third cycle of IVF treatment. The success also depends on what direction of the treatment is. Now, if someone requires surrogacy or say donor egg or donor sperm, and they are still stick with their own uterus or say own egg, then the success is still far away. So the age of the couple at which they start the treatment and the direction of the treatment, that matters. So if you want to reduce the number of cycles and the cost of the treatment, the right direction of the treatment is important.
So if you're talking about someone older, I mean, that's something you can't reverse. So a woman coming 42, right? And she says, I want to have a child. What's the likelihood of the cycle she has to go through?
Put some data. Like if someone is trying at the age of 30, the chances of having a live birth is almost 40 to 50%.
Okay.
Right? And if someone is trying after 40 years, when the egg is already exhausted in the ovary, the number of egg that we get after ovarian stimulation during IVF is already low, and the quality is also compromised. The live birth is less than 5%. So even if they try for 10 cycles, this success is still far. So that's why I said the direction of the treatment is important.
Okay, let's talk about egg freezing, because that's another thing you're finding. Well, I guess you can say a lot of career women are considering, because the rat race to chase the bag, to kind of excel and progress in your career is tempting to many, and they're putting off childbearing until later years. So, what does that option look like for someone who's considering it? I'll start with you, Julia.
First of all, it's something that is doable for any woman who's above the age of 20 years old. So because, as you've mentioned, many women, and not just women, by the way, even men also do freezing of sperms, because many people can either be a medical condition. So when someone is going through cancer, for example, they cannot be able to have the treatment after the cancer treatment. So they opt to start with freezing the egg, then they can be able to conceive after they've done this treatment. So what we do is we take the egg and the sperm during this period, and then we create the embryo. Once the embryo is created and it's stored in our labs, because we have world-class lab facility, then they can be able to now either use a surrogate to help them with this treatment or to help them with now the pregnancy, or in the event that they're still okay, then they can be able to carry on and bear their children to term.
So what is that process? How much does it cost from retrieving the eggs, freezing? What's that cost?
Yes. So on average, it costs between 70,000 shillings to 100,000 shillings for both the sperm and also for the egg.
And do you have to pay an annual fee to kind of keep the storage going?
Yes, at Fertility Point, we have various options, because there are patients who would prefer to store their eggs at a certain time, such as maybe 3 months. We give them that at a fee of, which is covered within the treatment option of IVF. And if it is done after 3 months, then they are able to now pay the annual fee.
Which is?
Which is now 100,000 for eggs and 70,000 for sperm.
Okay,
yes.
So the ideal age is 20s. And I'm just thinking someone who's in their 20s is just starting their career. They can't afford 100,000 to store their eggs. And even as the older a woman gets, the quality of her eggs also is impacted. Dr. Rajesh, speak to that a bit, because by the time a woman is thinking, I have enough money to put, they're in their 30s, right? They don't have the quality of a 20-year-old anymore.
The best time to freeze egg is before 35 years.
Okay.
So in 20s is a period when women, the girls, they are still girls, and then they are pursuing their education. Career is started after education, which is late in the 20s. And if they are not planning for pregnancy for whatever reason, maybe a social reason or a personal desire to not have family at that point of time, then they can opt for the freezing her egg. Now, there may be another reason for not having pregnancy that time. Maybe she have not find a right partner. So, and another reason for freezing egg is medical condition. Like if someone is having a cancer or going for the radiotherapy, then that's another reason for the egg freezing. But nowadays, the social egg freezing is more on the trend. Social reason means that not getting a partner at right time, at that point of time, or for career reason. So I think it's 32, if not 35. At least 35 should be considered the cutoff point. Even they can consider freezing an egg at the age of 40, but the best is the before 35 year. Now, what should be considered during freezing egg is like how many eggs should be frozen, right? And whether that will guarantee you the pregnancy later in the date or not. Because when you will consider getting pregnant at the age of 45, then by that time your uterus may be affected with other conditions like adenomyosis or fibroids. Then even if you get a good embryo, and then that the uterus may not be good enough to hold the pregnancy. So all these factors should be considered while delaying, while you think that you should delay your pregnancy.
And is there anything that someone can do beyond, of course, the help that you can get from IVF and other assisted fertility options? For instance, nutrition, or just kind of keeping healthy and active. What are some things that someone can do before you go the IVF way?
Just to optimize the body condition, like for pregnancy, like the hormonal conditions should be checked in, like the thyroid condition or any other condition like diabetes or hypertension. Now, these problems are something that is related to age. Now, if you are 30, the diabetes may not be there. But if you are like 40 or 45, then diabetes may be inevitable or on the progress. Or thyroid may be on the progress. So these things should be screened off, and then you should maintain the body weight. Like body weight is, if you are very obese, then that may be, the IVF process itself is very difficult. And then the pregnancy also becomes a bit difficult because obesity will invite some other medical condition as well, like hypertension or diabetes apart from that. So the body weight and this other medical conditions should be checked regularly.
Finally, as we are running out of time, let me come to you, Julia, because there's also the stigma attached to people who go through IVF. And there's this it's an unfortunate term when they talk about test tube babies. And, oh, did you go through that process? And yet, that's something that couples have desired for. That is their path. But how do you demystify and deal with the stigma that's attached to IVF?
Okay. First of all, we have to understand that by the time a couple is considering IVF, they're going through a lot of emotional distress. Remember, it causes a lot of psychological distress, not just from the family, from the community, from the people around them. People have been married for 5 years, 10 years, they still don't have children. There's a high expectation and a high burden for them to have a child, maybe for certain reasons such as family legacy, to continue even with that heritage of having a child in that home. So the stigma is something that we have to also understand, because it is a process that is done outside of the human body. But when the embryos and when the child is coming to term, they're normal. We have very many success stories. At Fertility Point, we have more than 3,000 successful pregnancies, which we've had since our conception. And we like to continue with that trend because, remember, these children are growing in the society just as any other child. So that stigma is something that we have to constantly have a conversation, because this is one of the starting points, right? It is a taboo to discuss infertility, even within the homestead, even within churches, even within the community as a large. But we need, even as a whole, and even as government, and even through other community agents, we need to start demystifying that this is just a treatment option, just as we treat any other disease or any other anything that can be affecting the body. So when children are born through IVF, they come out normally, and that's the hope that we'd like to give them. Yeah.
Okay.
Let me add
Yeah,
on
sure.
this. From where this stigma around the IVF and surrogacy has come through the culture, our society thinking that sex is required for the pregnancy. Now, IVF is something that you can get pregnant without sex. So that belief has been tormented. And now, gestation is one thing. I mean, getting pregnant is one thing, and mother is another thing.
Right.
Like with the help of IVF, you can get the motherhood without getting pregnant. And now that has challenged the traditional belief, and that's why there is this stigma against the IVF and surrogacy. But I believe now the society is moving a bit fast, this generation, and then all this stigma will be slowly wiped off.
And hopefully this kind of conversation starts to do that. Thank you so much, Dr. Rajesh and Julia, for your time. Of course, World IVF Day is coming up this week, so take some time to learn more. What's happening at Fertility Point? Can people get more information?
Yes, you can visit our website at www.fertilitypoint.co.ke or call us on our number at 0792 111 222. We have discounts that we've offered during this month, so please visit us and call us if you need our treatment options, and we can give you more information about these services.
Fantastic. Thank you so much for your time. Let's take another short break here on Citizen Weekend. Sports news up next.